Well, convalescent plasma therapy, the way that we're using it now, no, it's a form of compassionate use, compassionate therapy. It is a treatment of last resort right now. Kasi to tell you honestly, there are no clear-cut evidence yet that plasma therapy works in COVID-19. So ngayon, ang ginagawa lang namin, parang as a rescue therapy, especially those who are severely and critically ill, we will give plasma from a survivor, from a donor who survived and recovered from COVID-19. That donor's blood has, or the plasma themselves has antibodies. We give those antibodies to someone who's very ill. Okay, so far in PGH we had 6 recipients.
Okay.
And as of now, as of this mga around 6 p.m., I was trying to get an update. 3 out of 6 po ay recovering, stable, but we lost 3 out of the 6 because they're really in bad shape. To begin with, they're very critical.
Okay.
But Doc, kasi medyo maliit yung sampling ng 6 eh. Would you have other numbers to aggregate into that 6? And just some sort of idea as to ilang percent more or less yung nagre-recover from plasma therapy, not just PGH, if you have numbers.
Yeah, I just listened to the report of St. Luke's. It was featured in another news. They said about 50%, parang 5 out of the 12, they were able to pull out of the ICU. Hindi ko alam kung yung ano pa yung 7, no? Hindi ko alam. Pero at least 5
parang
successful na. Parang 50% eh. Tapos, yun, sa ngayon, ganun. Ngayon, we actually...
Doc, sorry, 5 out of 6, that's not 50%.
5 out of 12 eh.
5 out of
12, okay. Okay, sorry.
Tapos
Okay.
3 to 6.
Tapos meron pa kami, parang ganun din. We also donated blood plasma for Senator Alvarez.
Yes.
He was not hospitalized in PGH, but there was a call for a plasma, so we donated plasma for him. Unfortunately, he did not make it. And then we also donated plasma to Asian Hospital. There were 3 patients who received it. So out of those 3 patients, 2 are doing well. I think 1 did not make it.
So what do you think is the unique, sabihin na natin, proposition ng plasma in terms of timing? What makes it work and what makes it not work?
Well, I think we probably should be giving it sooner. When I say sooner, probably not in a situation wherein the patient is almost about to die. Yung parang, kumbaga, nasa peligro na. Kasi,
Nakabulin mo na lang eh.
critical, pag sinabing critical, in shock, naka-intubate na, naka-ventilator, meron ng tinatawag na respiratory failure, overwhelming infection, so you're just trying to salvage, versus giving it a little bit sooner when they are not yet in the ICU, but they have a potential to deteriorate. That's, I think, the good time to give it so that we will prevent them from deterioration.
So how many days are we talking about when you say sooner? Third day, fourth day?
Actually, our protocol right now, we count, plasma should be given in our protocol from the onset of symptoms. We count, let's say, the start of the symptoms. It has to be between day 3 to day 21. Yan ang aming, so it cannot be before that, it cannot be after that. But it's not really the timing as to the day, but it's really the condition of the patient. The condition of the patient.